Okay, we're doing the fat transfer. You can see here that um, what we're trying to do is today is to do a fat transfer around her eyes. We could have done this with Juvederm or something like that, but fat will be a little bit more permanent. We've already numbed up her face, so she really shouldn't feel this. Is that hurting you? Good. Her main complaint was bags around her eyes and a slight depression underneath her eyes. So the goal of this is to give her more fullness so that you don't see the outline of her bone anymore, which you can kind of see across here. Take out the slack of her lower eyelid. So, when another doctor had suggested that she do an eyelid surgery where you cut out the extra skin, and I didn't think that she had enough extra skin to really need that, even though she may benefit from it. What this will do is fill this area up like it should be, so that you can't really see that bone as much. And then we're going to put a little bit into her cheek too, so you can see that this is much more full already. And we're going to take this all the way around. We're going to fill up her cheek here and then all the way down to here. So obviously she's pretty and she doesn't need a whole bunch. We don't want to make her look distorted. She was nice to drive here from, no, she flew from South Carolina. So I put my finger up here so that obviously I protect her eye, and mainly so I can actually feel the bone, because I want to put it right along and above the bone. That way, as I said, that camouflages the bone, which is the goal. And so very frequently we'll use fillers, like I said, to do this. The benefit of fat is it's your own tissue, so there's no potential of rejection. It also lasts longer. Ultimately, it's more cost effective because you have no real overhead, considering that it's your own tissue. So we, as the plastic surgeon's office, we don't need to buy the material. And then obviously if we buy the material, we pass the cost on to you. Okay, so you can see we're outlining this whole area. Just want to do little bits at a time. She has great cheekbones to start with, so we don't want to put too much into her cheek area, or at least not into this upper cheek area. One thing about fat, unlike Juvederm or other off-the-shelf products, is that it does require a larger needle like this, but as you can see, she's pretty numb. But also it causes a little bit more trauma to the tissue, and because of that there's a lot more swelling. So what you'll see after we're done is she's actually going to be quite swollen, so I don't want you guys to think that she's going to stay this big, because she won't. She's going to wind up to be about maybe 3 times bigger than she will be, and that'll go down within the course of about a week. Okay, so we're just kind of bringing it down into her lower cheek. What this will do, just like if we were to use filler, is this fullness up through here will bring her whole cheek up, because the skin will fill up more, and that will actually decrease the outline of this fold, which a lot of people hate. Also, we're going to put some right into the fold itself to soften that up. And so you can see she looks pretty natural, which is obviously the goal. So right now, this is our 3rd syringe. So if you think about, for those of you that have done Juvederm before, you know that oftentimes, you'll buy just 1 syringe or maybe 2 syringes, and you think that's too much. Right now, this is our 3rd syringe of 3 cc's each. So we're actually putting close to 9 cc's into her, equivalent of 9 Juvederms into this cheek area. So that's how you kind of know that that 1 cc that you're buying usually is not too much. And obviously, I'm the first to tell you that Juvederm is pricey. And so 9 cc's of Juvederm would be a little bit on the expensive side, but we can do this with, again, with fat much more cheaply. And fat also is so much softer as a material than any other product, so it's actually easier to use. So you can see the cheeks on both sides now. You can see this outline of here is really low, and now we've built all of this up, as well as give her a little bit more cheek right here, and so a little bit more up here we're going to do. But I think we're going to call it quits on the video. I think you guys can see how it works. I would appreciate everybody to give a like to the video, push like, and you can subscribe to our channel, which will also show lots of other surgical videos that we do. And this young lady, she found me on YouTube, and she came in from South Carolina just to have this done. So thank you.